Welcome. This is annual Medicare Open Enrollment period, and my name is Elaine Miller. I'm the Regional SHINE Program Director at Minuteman Senior Services, and I'll tell you a little bit about what we do, and I'll tell you about the SHINE program if you haven't yet made use of your SHINE counselors here in Stow, and we'll talk about what's new in Medicare this year. Starting in January 2025, what I know, and I'll give you all very impartial information today. I work for Minuteman Senior Services. We're not attached to any of the insurance products on the market. I know that you're all being bombarded with ads about various pharmaceutical Part D plans, Medicare Advantage plans, Medigap plans. So I'll hopefully clarify a little bit of that with you. And then if you'd like to schedule a meeting one-on-one here in Stow with a SHINE counselor to go over your options during open enrollment, we can do that after. So I'd like to not share a lot of personal information. So if medications, we're not going to get into that. I'm going to give you the high level, and then I'll take questions. And I'll talk about the handouts that are in front of you. So to start, Minuteman Senior Services is a state-funded aging service access point. We're one of 17 organizations in Massachusetts, and we provide primarily home care services to people that want to remain at home and independent. 50% of our agency is made up of care managers, and they have a caseload of up to 100 or more consumers in a particular area or region. We do cover 16 communities, including Stow, Harvard, Boxborough. I call it 495 North. We go from Littleton up to Stow. And we also cover out to Arlington, Lincoln, Lexington, Concord area. The SHINE program actually covers 2 additional cities. We serve Cambridge and Somerville as well. So it's a pretty busy program overall. So we provide state-funded home care services on one side of our organization, and the second side of our organization offers community programs that are all at no cost to people that are over 60 or people under age 60 with disabilities. I'm under the community programs umbrella. Our community programs include money management. We help disabled seniors or people with disabilities manage their finances each month and stay on track. We offer home-delivered meals. Most of you may know it as Meals on Wheels. It's been around for many, many years. We offer nursing home ombudsman services, so we have volunteers and a paid director that organize visits to each of the nursing homes in our territory to advocate for residents in the nursing home environments, long-term care facilities. And we just offer a lot of caregiving services, caregiving support groups, and information to people that call us out in the community that need help, either themselves or they need help for a loved one. So that's what we do in a nutshell at Minuteman Senior Services. And the SHINE program, which is one of our million acronyms, there's an acronym for everything that we do. It stands for Serving Health Insurance Needs of Everyone. It has been around for at least 30 years. It's a volunteer-driven program. It is funded in part by the Administration for Community Living, which is based in Washington. They fund programs in all 50 states, and the Executive Office of Elder Affairs here in Massachusetts is the state organization that the regional programs report to. That is also the agency where we get our information from. So anything that we share with you is vetted by the state, it's approved by the state, it's a trusted website. We don't just sit down and Google Medicare and see what pops up. We give you very honest, good information. So I report to Executive Office of Elder Affairs. I'm one of 17 programs in the state. My program itself is really the backbone of the program are volunteers. Here in Stow, we are a little bit shorthanded in terms of volunteers, but we have certified state-trained volunteers that go through a 40-hour program, and then they're based at partner organizations like the Stow Senior Center and all of the other senior centers within our catchment area. We try to have 2 volunteers at each site, and this is a time of year when we're really out straight. We see about 1,000 consumers, which is a lot, and overall throughout the year, in a 12-month period, the program sees about 3,000 in all. So it's a large program, and it's volunteer-driven. You had the benefit up until July of this year of Michael Matadia. If you've read your senior center newsletters, Michael used to draft an article each month and pop it into the senior center newsletter that went out to all people over 60. Michael was the Shine counselor here in Stow as a resident of Stow for 3 years. He was wonderful. He went into, his wife finally retired with him. So they did some downsizing, and they made a big move from Apple Country to Nahant on the North Shore. So that's where Michael is right now. Here in Stow, we are recruiting volunteers, but Amy Bonus is, she works for me, and she will be available to you after today if you have questions by appointment. If you know of anyone, we're always recruiting volunteers, and I know we're videotaping this, so anybody in the community that hears this that might have an interest in Medicare can certainly contact Minuteman and learn more about it. So Shine is, our program at Minuteman is made up of 40 excellent volunteers. Our volunteers have varied backgrounds from engineering, software, development. We have 2 retired pharmacists as part of our group, a retired surgeon, a nurse practitioner, now retired. We have traditional homemakers that are empty nesters that have come into the program and learned everything from scratch. And we have a couple of attorneys that don't like to admit that. So, and one is available also to Stow residents over in Acton. She's now retired, and she worked with individuals. Her law efforts were focused on elder law issues, trusts, and estate planning. So she's very, very good. Her name is Leslie Madge, and we have Kathy Myers in Acton as well. So the Shine counselors go through a 40-hour state certification, and then annually they recertify, which is much easier. It's a wonderful group. We meet 10 times a year, once a month on Zoom. We have hybrid meetings. We share information, we talk about cases, and we all learn together. And part of my role is to make sure all of the information that we share in the community is accurate and help people understand any changes going on in terms of Medicare. So that is Shine. What we do is assist any Medicare beneficiary with insurance needs, and that means people that are under age 65 on Medicare due to a disability. So we work with people of all ages, but I would say the majority of our consumers are between, say, maybe late 40s up to over 100. We have talked to many people that are in their late 90s that are still living in their own homes, that are very with it, and contact Shine for information each year. So if you're on Medicare, it's a free service, and we're happy to help, and you don't have to go to a financial advisor to get this information. We do a lot of community education year-round. During Medicare Annual Open Enrollment, we visit each of our locations to do workshops like this, present new information that you might want to be aware of as you're making decisions for next year. And we also do new to Medicare workshops for people that are thinking about retirement, turning 65, and need to know what to do. They need, what is Medicare? What does Medicare cover? What doesn't it cover? Why do I need a supplement insurance? How do I enroll? So I do those at Arlington Adult Ed, Cambridge Adult Ed, and all throughout the community whenever a council on aging asks for our services. We also do workshops for individuals that are low income, and here in Stow, we do see people that live in housing or are struggling in their own homes to pay their bills, and they may qualify for public health assistance programs. So I like to kind of talk about the myth that there's no poor people in Lexington, Lincoln, Stow, Concord. We have low-income people everywhere, and we are here to help them access health benefits that are no cost and federally funded. I'm not going to go through a lot of the Medicare 101. The slides will be available online to residents and anyone that's not familiar with Medicare or thinking about retiring or turning 65 will be able to look at the Medicare 101. But I'm assuming because you're here, you're already on Medicare A and B. No.
No.
You're not on Medicare?
No.
Okay. Well, good to know, because now I will get into Medicare 101 with you, and you'll know what you need to do and when you need to do it. So Medicare was federally funded, I believe, under the Lyndon Johnson administration many years ago, along with Social Security, and it was not designed to provide you with 100% insurance, but it was designed to provide you with good coverage in retirement at age 65. Medicare Part A is the hospital side of insurance, so anything that happens while you're admitted as a patient to the hospital is covered under Medicare Part A. Medicare Part B is medical outpatient insurance. Medicare Part B comes with a premium, and as of today, the Medicare Part B premium is $174.70. That is effective through December 31st. We are awaiting information from Medicare on the premium changes for 2025. Each year it goes up very small amounts, but between $5 and $10. According to AI, the Medicare Part B premium for 2025 will be $185, but that's AI, and I can't rely on that. So right now it's $174.70.
It doesn't matter what your income is.
It does. There is a IRMA. I don't know what that acronym stands for, but basically if you're earning up to a married couple earning up to, I believe it's $196,000 combined, would pay $174.70. The highest that the IRMA could be is for an individual that's earning over $500,000, period. So you could be a billionaire and pay $456 for Medicare Part B. That's the highest it would go. IRMA is adjusted based on your last year's tax returns. So if you're enrolling in Medicare now or in 2025 at retirement, your Medicare Part B would be adjusted based on your current tax return for 2024 or 2023 if you're thinking about enrolling in Medicare now before December 31st. As your income changes during retirement, your salary is gone, you do have investments. You know, IRMA may never go away for many people, and that happens frequently in the service area, and they adjust. I mean, they've made good investments, good choices, good retirement planning, and they adjust to making those payments. Medicare is not a family plan, so it's individual. So each part, you and your husband, wife, each pay $174.70, unless you have a higher earning. So that is Medicare A and B. Medicare comes with a lot of, let me see if I have the preventative benefits. Medicare Part B preventative benefits for 2024 are on handouts in your folder. They're white, and it's a list of all of the free Medicare Part B benefits that you're entitled to. And many, many screenings. They've added many vaccinations. The only vaccination that's actually missing from Medicare that I would like to see added is the shingles vaccine. But other than that, all of your screenings, mammograms, colon screening, obesity therapy, prostate cancer screening, your vaccines, smoking cessation, bone mass measurements, alcohol misuse, and many, many other benefits. Now, you will note that it says annual wellness visit or welcome to Medicare visit at the top. Those don't they don't consider those physical exams. So it's not a full physical. There's no diagnostic labs. It might be a meeting with a new primary care doctor, and that is considered a wellness visit. Excuse me. So those are preventative benefits under Part B. Any benefit that Medicare offers you is approved by Medicare, and it needs to be doctor ordered. So if it's a doctor ordered procedure in the hospital, it's covered by Medicare Part A. If it's a doctor ordered service, test, lab, ordered by the doctor on an outpatient basis, it's covered by Medicare up to 80%. You would be responsible for the, excuse me, 20% out of pocket if you did not have a supplement insurance plan that I'll talk about today. So in other words, if an MRI is $5,000 and you did not have a Medigap supplement, your out-of-pocket cost would be $1,000 for that service. You'd be billed. Medicare Part A also has a deductible if you don't have a Medigap, and the first hospital day is $1,632 out of pocket. So that's enough to let people start thinking about, well, I don't really want those unexpected costs. And I hear about the Medicare Advantage plans, and I want to know more about, how I can reduce or minimize my spending in terms of healthcare. So I'll talk to you about that today. So you've got your Medicare A, you have your Medicare B. If you're 65 and you decide that you want to delay your retirement and you work for an employer with more than 20 employees, you're able to stay on your employer group health plan until retirement. You don't have to do anything with Medicare until you calendar the date and start talking to your benefits administrator. If you are in a situation where you're on COBRA and you're 65 or that happens, you do need to enroll in Medicare A and B because COBRA will not be sufficient coverage. And if they know that you're 65 Medicare eligible, they want you to enroll in Medicare because they'll bill Medicare first. So keep that in mind. I hope no one goes through that situation, but if you're in a COBRA or you know someone going through that, let them know they should enroll in Medicare A and B if they're 65 and eligible. So if you continue to work, you do nothing. And if you do decide to retire at 65, you can enroll in Medicare on the first day of the month that you're going to stop working, and you will be covered seamlessly for when the last day comes. So you leave the last day of the month, your employer, you're covered the first day of the next month by Medicare A and B. You can enroll in Medicare very easily by calling Social Security Administration, or has anybody set up a My Social Security account? You can set up a portal for SSA under Social Security Administration, and that portal is your secure place where you can view your work history and your earnings. And it's good to review your earnings because sometimes Social Security might make a mistake, and you might pick that up and say, well, they didn't take last year's income off my tax returns, or I'm missing a couple of years. It does happen, especially if you've worked for 40 years. There can be an error. So it's good to look at your work history, and Medicare is available to anybody that has worked 10 years or longer, 40 quarters they call it, or you're married to someone that's worked 10 years, or you're divorced from someone that's worked 10 years. Medicare doesn't cover partners, so you have to be a married couple. Social Security is the starting point because, as this gentleman indicated, he asked about IRMA. They can see your work history, they can see your earnings, and they will tell you what your Medicare Part B is going to cost based on your taxes and your income. So that will happen by either calling Social Security, which has a very good customer service line, or setting up a My Social Security portal with your own username and password. Each time you log into the portal, it does the two-step authentication, so you'll get a alert on your phone. You'll have to pop in that number. There's some secret security questions, and they do keep it very locked down, very secure. Obviously, it's Social Security. They don't want any mishaps, so that's why they text you the code. So that is where you enroll. And you can also enroll in person at the local Social Security office. Here in Stow, I'm not 100% certain where that office might be located. More familiar with Cambridge. Lowell has a Social Security office. I don't know if you would go to Fitchburg, I'm not sure, or Leominster potentially. Waltham would be for Stow, okay. So you can go to any Social Security, you can go in the morning, and you can talk to someone face-to-face and make sure everything's done, if that's your preference.
Is it like the DMV, you sit around?
I always,
I've
yeah.
been to it.
Yeah.
Just walk in?
You could do walk-in, but you can make an appointment, but the times that I've done the walk-in, if it's during the week, it's been pretty, not too bad.
My advice is always to try to go in the morning. You don't want to sit there step in at 3 p.m. and end up being sent home because they can't see you. But they have excellent customer service. Right now, it's Medicare Annual Open Enrollment. Their phones are crazy, but I would always suggest try in the morning, and Waltham, I think they'd be very helpful. So we talked about Medicare eligibility and enrollment. Other people that are eligible for Medicare are people under 65 that they have a disability, and that's been determined by Social Security that they are indeed disabled. They've been disabled for 24 months at least, and they're now eligible for Medicare to help them with their costs. This happens to a lot of younger people that might get injured at work. A nurse, an older nurse, might get injured at work or ill, not be able to return to work. They're on long-term disability for 2 years, or the family leave, and then they need to apply and work with their doctor. If they are definitely disabled and cannot go back to the workforce, they would be eligible for Medicare Part A and B after 2 years. And I know people personally that have been professionals, and they do have diabetes or chronic disease, and they can't retrain for a position when they're in their late 50s, so they are eligible for Social Security. Social Security has quite a rigorous criteria, and that is all done with the doctor. Medical notes, diagnosis, multiple diagnosis. Then people in that situation would receive a letter from Social Security that states that they're now eligible for Medicare A and B, and this is how they can enroll. Medicare also does everything in writing. Social Security does everything in writing. They don't call you. They're not going to email you. So you'll always get written correspondence sent in the mail, and it's legitimate. Other people that are eligible for Medicare immediately are people that are diagnosed with ALS, which no one wants to be diagnosed with, or an end-stage renal disease. So those are just two of the illnesses that are the terminal, and you're immediately put on Medicare A and B, so you can enroll in an insurance plan. So the slides that will be shared on the video include the Social Security Administration number and website. And I can also ask here at the Stow Council on Aging if they will make 4 copies of the handout to give you before you leave, okay? So you have a whole bunch of different enrollment periods during to enroll in Medicare. You have a lot of enrollment periods. You have special enrollment periods, but just don't forget that you have your general initial enrollment period. Your initial enrollment period is a 7-month window, 3 months prior to turning 65, the month you turn 65, and 3 months after you turn 65. So you have a 7-month window to enroll in Medicare Part A and B without penalty. If you delay beyond 7 months, you will have a Part B penalty applied, and I believe the Part B penalty is 10%. So we want for you to work with your employer, have your retirement date in mind, and know when you need to enroll in Medicare, so that you can be fully insured at retirement. Every year, there is annual Medicare open enrollment, and once you're enrolled in Medicare, you'll be receiving a notice every September from Medicare called the Annual Notice of Medicare Coverage. That will tell you what your Medicare coverage benefits will be for the following year, and it's a reminder of annual Medicare open enrollment. So open enrollment is a 7-week period that starts every year, October 15th, and it ends on December 7th. So we're right in the middle of that right now. We have 4 weeks to go, and this is when the SHINE program sees huge numbers of people. All of our appointments across the region are booked through December 7th. People like to take a look and make sure they're not overpaying for insurance. They might want additional benefits that aren't offered on their existing plan. I think that we all look at our house insurance, we all look at our auto insurance. It's the same thing. You have a plethora of options to choose from that are in this folder, including over 30 Medicare Advantage plans. So this is why it's good to sit down with a SHINE counselor, and I'll also show you a tool that you can use at home during open enrollment. So that is annual open enrollment, initial open enrollment, plus you have a do-over January 1st through March 31st. If you join a Medicare Advantage HMO plan during annual open enrollment and you find that your primary care doctor doesn't accept that, which is a big mistake, if you don't ask your doctor, do you accept this insurance? You can drop out of that Medicare Advantage plan anytime between January 1st and March 31st and choose another one that your physicians do accept. If you fail to enroll in Medicare Part B during your initial enrollment period, you can enroll in Part B also during January 1st through March 31st. The issue is that your coverage wouldn't take effect until July 1st. So these timelines are all important. It would also be important to look at the Medicare.gov site for anybody that's under age 65 that hasn't yet done that. You can request a guide be sent to your home. It's many, many pages. You can also read it as a PDF online, but if you prefer the hard copy, they will mail you the publication. It's called the Medicare and You Handbook, and it will tell you everything you need to know about Medicare to prepare for it.
Question?
Yes.
Oh, I saw your hand first. I have one as well. Go ahead.
So if you're already enrolled, do you still have to re-enroll?
No.
Or is it automatically, unless you change it?
You will never have to re-enroll in Medicare once you're enrolled.
But how about like Part B or Part D?
Once it's done through Social Security, you have a Medicare A and B number, and you have a card, and it will never change.
But how about Part D?
Part D
Part D?
is the drug plans, and those are on the market, and they do change. You can change. During
What
open
if you don't-
enrollment,
But what if you don't want to? If you want to keep it the same, do you still have to?
no, you do nothing.
You could do nothing and then it'll just be the same.
Right,
Okay.
right.
But you can change your choices every year. If you find out you don't like this advantage plan, you can go to some other one maybe.
Or if you're moving, and that's also a cause for a special enrollment period. People retire, they might not stay in the area. Better benefits, most people. At minimum, you need Medicare Part A, Medicare Part B, and a Part D plan. The Part D plans start at $12 a month. That's drug coverage. And there's a number of plans that I'll talk about today. That is your drug coverage. And if you're taking a couple of generics that don't add up to a whole lot, you do want to take the lowest cost Part D plan. There is a $590 Part D annual deductible, and there's a $245 annual Part B deductible. However, the Part D companies often cover the $590 deductible with lower tiered drugs, and the Medicare Advantage plans may also, some of them also cover your Medicare Part B deductible. So you can defray, that adds up to about $750 out of your pocket.
Is that mostly for people that are on medication like every day, they're taking something throughout the year, or is it the doctor prescribes me something because I've got some infection and he says take this for 10 days? What should I be having a part?
What we do when we talk with people about their options is we use a tool called the Medicare Plan Finder, and people that are on medications will bring us their dosage and the name. We pop it into a tool, and it calls up the best Part D plan for that person, and it actually calls up all of your out-of-pocket costs for the entire year. So if you're taking a blood pressure medication, which is $9 a month, and you're on that for 12 months continuously, you're never going to reach your $590 deductible. If your doctor does,
$50 a month for the benefit or whatever that.
you have to pay $12 a month, yeah, at the lowest cost. That's a WellCare plan, the lowest cost. You do need to have a Part D. It's minimum coverage. If you don't join a Part D, there's a penalty down the road. It's a minor one. It's 1% of the cost of the premium. Not to exceed, the cost of the premium can't exceed $34. And, but there's no reason not to have a Part D plan, for the $12 a month for the WellCare plan, because you don't know if the dermatologist is going to prescribe something during the course of the year that you need. Medications are also tiered in 6 different tiers, and every plan has different formularies. So every single plan on the market nationwide has their drugs tiered, and they have a formulary. And only a computer could tell you what that is. So the Plan Finder is the best place to go for that information. I'm gonna move.
So A, there's no choices. It's just, A is just A.
A is A.
B, there's no choices.
B is B.
It's just B. And then D, if you're not taking a lot of medications, you could start at a lower.
Definitely. If you're taking 0 medications.
You could change that year over year.
Yep.
As you start to take more medications.
Exactly.
Okay.
Now, the Part D plan is a standalone plan, and that's for individuals that choose to have their Medicare Part A and B, a standalone drug plan, and a traditional Medigap supplement, which is a Blue Cross Blue Shield, or any one of the companies listed on the blue sheet. The difference between a Medigap supplement and a Medicare Advantage plan is that Medigap supplements travel with you. You can go to any doctor. There are no networks, and there are no pre-authorizations. You want a second opinion, you get a second opinion. You want to leave the area to go to Dana-Farber, you go to Dana-Farber. You will pay for that, a premium monthly of $129 for the lowest cost plan, which is called Core. I know this is confusing. The Core plan, the difference between the Core plan and the Supplement 1A plans is that the Core plans do not cover the first hospital day deductible or any other deductibles, the Part B deductible rather. So you'd be responsible for that. People can join the $129 Blue Cross plan thinking that I'm not going into the hospital next year, so this will be fine with me. But you don't know that. You don't know if you're going to have a slip and fall and be overnight in the hospital. So I think people that want a lot of choice, that do a lot of traveling, you have grandkids that live in another part of the country, you're a snowbird, you don't want the hassle of getting a referral, you don't want the worry about having an emergency out of network. These Medigap supplements give you complete freedom. And despite the fact that there are a number of different companies offering them, the benefits are exactly the same. So the first one that you see on this list is going to have the same exact benefits as the one that is at the bottom of the list, costing $230. So what I like to say to people is you don't need to pay more than you have to, because they're exactly the same plan. And on the reverse side of the blue sheet, it gives you the differences between the core and the supplement 1A in writing. So you can study that at home if you haven't yet signed up for Medicare A and B. So at minimum, you'd have Medicare A, Medicare B, and a Part D. Most people like to have they want good health insurance. They want to know that they're well covered in the event that they receive a diagnosis, they have a slip and fall, they have a planned surgery. So most people do opt in to purchasing a Medigap supplement, the traditional with a Part D, or a Medicare Advantage plan. The Medicare Advantage plans,
Just hold on.
sure,
So you just pointed to this page here, so on the second column from the left, it says supplement for monthly premium, then it says supplement 1A monthly premium.
mhm,
And so, could you just elaborate a little bit on what
sure.
those columns, what these handouts are actually showing?
Yes, so the cost for core, if you have the core plan, you're responsible for the $1,632 annual hospital deductible for first hospital day. You'd also be responsible if you were in a skilled nursing facility beyond 20 days.
So there's two levels of supplement.
Yes, and that's why the,
4 and 1A.
and the price difference reflects that.
Okay.
With 1A coverage, it's one price, that's what you pay every month, period. There's no surprises, there are no other bills, and I can speak to this from personal experience because I have a relative on a Medigap supplement that had back surgery, went into rehab after a lengthy hospital stay, and paid nothing except the monthly premium and her Part B premium. So the most that you would pay out of pocket for having insurance is your Part B, let's say it's $174, and the $229 supplement 1A plan, plus a $12 Part D plan. So $229, $329.
So where do you get the two,
Yeah,
right here it says two.
Oh, $212, I'm sorry, I apologize. $212 plus the $174 for Part B, plus a $12 drug plan. That's the most that you would pay for medical. It's difficult for maybe a couple, and what I like to say to husbands and wives is that maybe one person needs this kind of coverage because they go to specialists, they go to different hospitals, and they need the flexibility without the pre-authorizations. But maybe somebody else is in like excellent health. They take no meds, they take vitamins right now. Their doctors are all in the Medicare Advantage network. Their hospitals are in the Medicare Advantage network. Those Medicare Advantage plans don't cost you a thing, zero. They offer dental coverage up to $1,500 a year, which the Medigap supplements do not. They offer you vision and hearing reimbursement and exams, which Medicare doesn't cover. They offer you fitness benefits, and they're very creative with those. You can play golf and submit for your tee times. You can go skiing and submit your lift ticket. So they're getting more and more creative. They offer home-delivered meals to people that are released from the hospital that need food. They also offer debit cards where you can receive up to $250 quarterly, and you can use that at your local pharmacy for over-the-counter. And in some cases, some plans allow you to use it for grocery shopping. So the Medicare Advantage plans and the Medigap plans are different, and there's pluses and minuses to each.
So just getting back to this.
Yes.
So are there there's four or five rows of metrics comparing core versus 1A.
Mhm.
Are there other metrics that, or is, that's really it?
This is it. So you'd be responsible for $1,632 if you went to the hospital overnight and were actually admitted, and $240 annual Part B deductible. So it's roughly, what, $1,900? Yes.
But I guess to kind of maybe to answer your question, and this is my question too, so it's almost like you have two paths, right? You have a choice of doing Medicare A, B, and D for the prescription and the Medigap,
Yep.
or instead of doing that, you have Medicare A, B, and you do the Medicare Part C Advantage,
Right.
right? So I guess my question is, what is the difference, what is the advantage of doing the, the C? Because the C covers D and the medical gap.
Medicare Advantage plans, which are called, sometimes referred to as Medicare C, are all inclusive. They cover your drugs, your outpatient,
So that's the Medigap kind of part.
yeah,
Okay.
your outpatient 20% out of pocket, and they cover your hospital services. They work as a contract with Medicare, and they manage your Medicare benefits for Medicare. In some cases, again, when you're a new retiree, 65, in very good health, most people coming out of employment are accustomed to having an HMO or a PPO already. There are many Medicare Advantage plans you'll find that your physicians already accept. So, and I'll show you how to find that out, or by calling your doctor.
So then on this sheet,
Yep.
in the pink box, it would also cover the Medicare supplement or the Medigap.
Yes,
It's sufficient to cover that extra, that 20%.
it covers, absolutely. Medicare makes the plans cover that 20% by contract.
So is there any, so I see the chart here, is there anything that describes the difference?
The difference between a Medigap supplement,
Going through the path of Medicare with D and Medigap versus getting Part A, B, and C. I know that this gives the choices for Part C, and this gives the
But-
choices where you do the D and the Medigap, in a sense.
and you want to know what the benefits of doing
Yeah,
each.
how do you compare the
So-
different paths, I guess?
Right, Medicare with Medigap and a Part D is really high level, high quality insurance. You're not in a network, you're not restricted, you're not asking your doctor for a referral to a dermatologist, you're not wanting to go to Mass General and can't because it's out of network. So you have tons of flexibility. You also have the ability to travel to all 50 states. And some of the Medicare Advantage plans are providing better coverage for travelers. But generally speaking, an HMO covers you on an emergency basis if you're out of network only. So if you're somebody that has kids on the West Coast and you go there frequently, you spend winters there, you might want a Medigap supplement. If you're somebody that sees a number of specialists because you have a chronic disease, you might want a Medigap supplement because you don't want to keep paying a $35 copay every time you see a specialist. That adds up. If you're a healthy individual coming into retirement, minimal meds or no meds, maybe you see a doctor once a year for your annual physical. I always say to people, why pay for what you don't yet need? If your doctors accept the Medicare Advantage plans and you're good with the hospitals and you're in good health, you can start with a Medicare Advantage plan that gives you the dental and the extra benefits. And then if your health needs change during the course of the year, there's annual open enrollment for 7 weeks. So you can say as you age in place, and we see this all the time. People start out at 65, we're all good, we're healthy. Maybe not so much when you're 83. So we see people that are older adults dropping out of Medicare Advantage plans this time of the year because they're out of pocket, the $35 copays for rehab, for therapy, for specialists is just, it doesn't add up. It makes better financial sense to have a Medigap supplement and that one fixed cost. The one fixed cost is also good if you want to be mindful of your expenses when you're on a fixed budget in retirement. So, but my theory is, why pay for what you don't need until you need it? Does that make sense? Okay.
You said some medical facilities or some doctors say, oh, we don't take Medicare. Well, maybe we're not using the
Well,
right terminology, but you implied the doctor you like might not take Medicare.
no, all doctors accept Medicare.
Okay.
They accept assignment, and that means they agree to whatever Medicare reimburses them for that service. All hospitals, unless it's a private hospital, like they're out of business now, but Stewart, you all heard about Stewart in this area closing down. So that was a private, for-profit hospital. But I don't know of any hospitals that don't accept Medicare, because how else would they stay in business if they weren't getting paid for their services? Because not everybody can private pay. But so the doctors accept assignment for Medicare, and each of the companies offering a Medicare Advantage plan have their networks of doctors and their networks of hospitals. And they're growing all the time. And you will notice on the handouts that a lot of the companies that sell Medigap policies also sell Medicare Advantage policies. We've heard about Blue Cross Blue Shield for how many decades? They've been around for many, many years. Tufts. They have both Medigap plans and they have Medicare Advantage plans. There are other newcomers to the market called Eternal Health. Mass General Brigham Hospital just entered the market about 2 years ago. Medicare rates these plans, Medicare approves the plans, and Medicare can sanction the plans if they're not following the rules in any way, or customer satisfaction. Medicare looks at all of that. So that's that on the difference between Medigap and Medicare Advantage in your Part D. The easiest way to look at it is to view the Medicare Plan Finder, which is www.medicare.gov. You can do a generic search by zip code based on whatever you take for medications. If you don't take any, that's fine. But you can look for a Medigap plan, a Part D plan, and you can also look for a Medicare Advantage plan. To make it easier for you, you can also come back to the Stow Senior Center and meet with a Shine counselor, and they'll do this with you. And they'll give you the printouts and make any phone calls that you might need to make to doctors, and just make sure you're making the right decision. So this is enrollment periods, and again, I'll get you these handouts. Enrolling in Medicare, we discussed that. We will be contacting Social Security when it's time. You can certainly delay. I mean, it doesn't make sense to pay for Part B if you're still in the workforce. And you don't need a Part D if you're still in the workforce.
Question, can you get off Part A? So let's say you were enrolled in Part A, but you continue to work.
You can have Part A because it's free. It doesn't cost you anything. At 65, you can join Part A. The benefit to maybe doing that would be that you're in their database and you get a mailing every year. There also may be, and I've not seen this happen, and I've been doing this for many years, another benefit may be there might be something that's not covered by your employer group plan for a hospital service, and Medicare would pick up the billing for that. So we talked about Supplement 1 and 1A, and again, these slides will help you a lot. I thought I was doing something different today. So, So Medicare open enrollment, we discussed that. Comparing Medicare options, the Plan Finder tool. Again, I'll ask our staff at the front desk to give you these slides. Really easy to use. There's a lot of white space. It's very easy to navigate. This is what it looks like. It has to look like this. There's a lot of fakes out there, so you can't just Google Medicare anymore because you'll get a ton of other stuff. So it has to look like this, and really easy for you to add your zip code and just do a search. And it gives you the most accurate pricing. You can set up a Medicare.gov account as soon as you have a Medicare number and a card. And that, again, is like the Social Security portal. It's the same. And it keeps, for somebody that takes 16 medications, it's great because it's locked down and secure, and you can change your medications without having to re-enter each one. You can change your dosage, you can delete, you can add, and you don't want to have to keep going through that exercise of retyping all of the medications in. So,
Do you sign up to get the Medicare card during that 7-month period only, or could you do it earlier?
you can't do it prior to 3 months of turning 65.
So everything, that's the starting point
Right.
for everything?
Yep.
Okay.
I always advise people, if you're thinking about retirement, to do it the month you turn 65, on the first day of the month. And then your Medicare A and B coverage is effective the following month on the first day. So, your card was red, white, and blue. We had a lot of that yesterday. I'm a little tired. Medicare Advantage open enrollment. So we discussed that. You can make a change. You sign up for the wrong plan. You did this without going to a Shine counselor at the Stow Senior Center, and you discovered that you've got to haul across to Leahy and Burlington because your hospital's not part of their network out here. You have a do-over, January 1st through March 31st. Talked about special enrollment periods, but none of you are involved in those at the moment. Special enrollment can happen, though, if you change, if a medication, for instance, is not on a formulary and you need that medication, we can potentially assist you in getting a special enrollment for a new Part D. If you move to another part of the state and your network is different, you automatically qualify for special enrollment period. The same if you move out of state. If you were on a public health benefit like Mass Health and you're no longer eligible, you get a special enrollment period. There's many special enrollment periods, and Medicare did add one for exceptional circumstances. That can be a disaster like what happened in North Carolina recently. People obviously can't enroll in, it's the last thing they're thinking about, cannot enroll in Medicare, so they are allowed an exception. Inflation Reduction Act that was passed a couple of years ago made things better for people on Medicare, especially people that have insulin. The first stage of the Inflation Reduction Act that was rolled out a couple of years back was the cap on insulin at $35. So any diabetic taking any insulin would not pay more than $35. This was huge because some of the insulins could be very pricey. They have also added as a second stage some labeled drugs and reduced the cost of those drugs. And each year between now and 2029, they're going to continue to add to that drug list to reduce costs, basically. This year, the good news for Medicare beneficiaries in Part D, starting in 2025, is the cap on drug costs, period. Nobody will pay more than $2,000, including your $545 annual deductible for drugs. And that's excellent for people that have chronic illness. So there's no more coverage gap. There's no more spending $8,000 and going into debt or spending on your credit card. And you can also, if you are on a fixed budget, spread that out over 12 months. And the Part D companies will put you on sort of a payment plan. So it will be easier for you to manage instead of having to come up with a big chunk of money all at once. So that's this year. And we're very happy about that, and I think that's why the program's been extremely busy. So I talked about Medicare prescription payment plan, and there is a program also called low-income subsidy, and starting on January 1st, 2025, people that are dual eligible, that means you're on both Medicare and Mass Health, can now use low-income subsidy, special enrollment period to change plans once a month. That doesn't affect anyone here, but if anyone in the community is on LIS, they'd want to be aware of that because they can drop out every month and get onto a new plan. We don't want them to do that every month, but there are also programs that people might not be aware of in Stow that help seniors and others with prescription drug costs. Now you have to meet certain income and asset eligibility criteria, but Mass Health, also Medicaid, is available to people that are low income. I will tell you the income's pretty low. It's about $1,300 a month for an individual. So, but we do help people apply, and we do screen people for public benefits. There's also a new program as of April of this 2024, Medicare Savings Program, which is available to anybody earning between $2,300 and $2,800 as an individual. And there's I don't have the rates at the top of my head for a couple, but what this does is allow those people to keep the $174 for Medicare Part B in their Social Security check, and it really will help a lot of older people that are on fixed budgets that are starting to outlive their resources, paying for heat, paying for taxes, keep that extra money. It adds up to about a $2,500 a year savings. So spread the word on that. Other than that, these are public benefits that we can screen you for through the SHINE program. And we have the Mass Health customer service number in the deck so that people can contact Mass Health directly to ask questions. Anybody that is self-employed, consulting, and on the Health Connector plan needs to not be on the Health Connector plan when they turn 65. It doesn't cover you at 65. Does that affect anyone here? Okay. If it did, you would just choose Medicare A and B and do the same thing that we're talking about. If you had a younger spouse and kids that were under your insurance, they would need to stay on the connector and you would go on Medicare. There are marketing guidelines, and the marketing's become much better this year for the Medicare Advantage plans in particular. We don't see Joe Namath 24/7 on TV, and I'm happy about that. So they're much more professional and straightforward. So no gimmicks. If you do find that you're being marketed to, door knocking, telemarketed, and it's annoying you, you can certainly report that to Medicare.
Is the government also monitoring like the amount of money these people are charging, or in the services you said that they kind of monitor what the services are and what they have to cover, but what about the cost of all of that? Can that be all over the place? Or?
The cost of what Medicare covers? No.
Well, these Advantage plans.
Medicare tells the Advantage plans, this is what we're going to pay. And they pay for service, they reimburse based on zip code, geographic area, prevalence of various diseases in that geographic area or not. It's called capitation. And Medicare will say when they enter a contract with a Medicare Advantage plan that this is what we provide for reimbursement. Are you in or not?
But in terms of how much they charge the individual for monthly subscription, is that governed or?
They all have a zero premium plan. No, anyone, any income. So if you're budget-minded and you're just signing up for Medicare for the first time, which you are, potentially you could pay $174.70 a month and have your Medicare Advantage zero premium plan. So there's a huge difference, that's a huge difference between a Medigap and a Medicare Advantage. And they all, most of them cover the meds, and the plan finder will tell you if not. And it's up to you, it's on you really to contact your physicians and ask if they accept it before you enroll. Or see a Shine counselor here at the Stow Senior Center. I'm going to keep plugging they'll be so busy, they're going to not like me, but anybody out there can come to the Stow Senior Center, make an appointment, call reception, set up an appointment one-on-one, and they'll look at each unique individual situation and give you handouts, run the plan finder with you, and direct you.
Question. So for these two handouts, which are Part B, one is updated October 23rd, the other one's October.
Yes, I apologize for that. Our copier,
Does one not apply anymore?
23 is out of date.
1023 is out of date?
Yep, as of 10/15, October 15th of this year.
So it says, this was 1023, October 2023.
Right.
So this is no longer applicable.
Right. The benefits have remained the same. They have added a couple, but the 2024, our printer just didn't pull that.
And then so the list of the benefits that are on the 10/15/24 Plan B, Part B handout for the Part C Advantage, do those service providers provide the same benefits, or are they?
Medicare Advantage plans all have to provide the exact same benefits. They can't deviate from that. They can't drop any of those.
So Advantage, original compared to Advantage. Part A is Part B, there's no difference. Part B to, and original to compared to Part C Advantage, the benefits in B are the same.
Same.
Okay. And then in D, you can choose, I guess, can you choose between the different Part D for the original? How do you know under the Advantage which part, what are the equivalent benefits between the Advantage Part D and these variations? Because the pricing is quite different across
It is.
the Part D original.
If we're done, we can cut, and I can pull up the plan finder and just show you.
Oh, okay.
It would be
Okay, that
so
be
much
great.
easier.
Yes, that would be- yes.
I'd just like to shut off the taping,
Very good.